Pleural effusion. Definition: Pleural effusion, also called fluid in the lungs, refers to excessive accumulation of fluid between the lungs and the breathing cavity. There is always a small amount of fluid in the outside of the lung that surrounds the membranes that line the outside of the lungs and lubricates the chest cavity to facilitate breathing.
Hi, my name is Jody Chapman, and I'm here with Dr. Ricardo Gonzalez-Rafi to give you an inside look into the pleura and the pleural space. What is the pleura exactly?
The pleura is a continuous membrane of cells that folds over onto itself at the apex and at the base of each lung.
What is the pleural space?
Well, the pleural space is a potential space that's between the parietal pleura that lines the inside of the chest wall and the visceral pleura that lines the lungs as the two pleural membranes fold upon themselves.
What are the functions of the pleura and the pleural space?
The pleural space helps regulate the pressure inside and outside the lungs during breathing. It is thought that the fluid in the space provides lubrication for the pleural surfaces on the lungs and the chest wall as they slide against each other during the breathing cycle.
How much fluid is in the pleural space?
This virtual space is estimated to hold between 8 and 10 milliliters of fluid per side in an average sized adult man. So it's not very much fluid, and under normal circumstances that amount is held at a pretty fairly constant volume.
What is pleural fluid? What kind of substances would you find in it normally?
Pleural fluid is a very clear plasma filtrate, if you will, which originates from the small capillaries in the chest wall, and it contains small solutes like sodium, chloride, bicarbonate, also contains glucose, as well as a small amounts of protein, including albumin. And when compared with serum, pleural fluid actually has near equivalent concentrations of glucose, but it has slightly higher concentrations of albumin and bicarbonate. In fact, the increased bicarbonate concentration results in an alkalotic pH of about 7.6 under normal conditions. Pleural fluid also contains macrophages, lymphocytes, and mesothelial cells that exfoliate from the pleura, and these are also found in pleural fluid in low numbers under normal circumstances, generally under 1,700 cells per cubic millimeter.
What are the mechanics of the pleural space? How does it work?
The fluid in the pleural space provides mechanical coupling between the two pleural surfaces, and it actually allows instantaneous transmission of perpendicular forces between them.
What exactly do you mean by mechanical coupling?
The mechanism of mechanical coupling is similar to that which occurs, say, when a glass coaster sticks to the bottom of a slightly damp glass. You have the thin film of fluid between the two smooth surfaces, and this creates a partial vacuum that forces the two surfaces to cling to one another, yet allows the two surfaces to slide against each other. A similar situation occurs between the two pleural surfaces during breathing, as the lungs expand and contract within the chest cavity.
Application in nursing indicates to the patient that he should remain in semi-position to favor lung expansion and improve ventilation. Explain that if you have a cough or to breathe hold, the chest relieve the pain a little. Concomitant signs that indicate a complication such as dyspnea, tachypnea, and cyanosis.
Where does pleural fluid come from?
For a very long time we weren't exactly certain how this came about, but during breathing the recoil of the lungs creates a negative pressure in the pleural space, especially towards the apex of the lung. And Plasma filtrate is drawn by a pressure gradient from the subpleural capillaries in the chest wall, and this fluid passes through the mesothelial cells of the parietal pleura into the pleural space by what are called Starling or pressure-related forces. So the volume of fluid in the pleural space is maintained in equilibrium under normal circumstances, such that fluid inflow is approximate to fluid absorption from the pleural space.
How is pleural fluid absorbed?
Pleural fluid is primarily absorbed through the mesothelial cell layer of the visceral pleura. Fluid also exits the space through these microscopic unidirectional valves that are in the parietal pleura, and they're known as the lymphatic stoma. And these lymphatic stoma are really only found on the parietal pleura. The stoma stretch during inspiration and allow cells and cell debris and other particulate products through. It's been recently discovered that fluid absorption from the pleural space also occurs as a result of what's called electrolyte coupling through the mesothelial surfaces of both the parietal pleura and the visceral pleura.
Pros and cons. The pros. An option to improve patient comfort is the placement of a catheter in the chest that always drains of fluid in the home and not go to the hospital for the targeted procedure. Cons. Chest pains usually a sharp pain that worsens with coughing or deep breathing, cough, fever, ictus, rapid breathing, difficulty breathing.
We've gone over normal pleural fluid mechanics. When you have too much fluid, it's called a pleural effusion. What mechanics are broken when there's a pleural effusion?
The thin film of fluid between the parietal and visceral pleural surfaces creates a partial vacuum of negative pressure, which forces the surfaces of the pleura to cling to one another. If you have too much fluid under pathologic circumstances, this disrupts the mechanical coupling between the chest wall and the lung, and the pleural surfaces no longer cling together. So the lung actually pulls away from the chest wall. And this increased fluid in the thoracic cavity reduces the vital capacity of the lung to fully expand during inspiration. And this can lead to shortness of breath and, on occasion, a feeling of fullness in the chest. The lung tissue, in turn, becomes compressed by the effusion, causing atelectasis of the alveoli and reduced ventilation to the areas of the lung that are being compressed.
Could you give me some examples of where you would clinically see a pleural effusion?
One mechanism of pleural effusion formation is that's caused by conditions that increase hydrostatic pressure. In the case of heart failure, you have increased left ventricular and atrial pressures, which cause a back pressure on the capillaries in the lung, and therefore you get interstitial pulmonary flooding. And this causes fluid movement and accumulation by transudation into the pleural space. The nature of this fluid is that it's a very low protein content, and as such it's usually referred to as a transudate.
Another example is when there's a tumor in the lung or chest wall.
That's another mechanism of pathologic formation of pleural effusions, and pleural effusion can form as a result of impairment of the lymphatic drainage. A tumor in the lung or in the chest wall can mechanically obstruct the thoracic lymphatics, causing a pleural fluid accumulation by decreasing the rate of absorption of pleural fluid that normally occurs.
In cases of pneumonia, you commonly see pleural effusions. What causes an effusion in that case?
Inflammation can increase the permeability or the leakiness of the lung and the chest wall capillaries as a result of inflammation and or infection. So you're right, a classic example of this mechanism of pleural fluid formation is parapneumonic effusion in the setting of an infectious pneumonia.
You can have an effusion when there's an unexpandable or trapped lung. What is a trapped lung?
Certain conditions can cause the lung to become unexpandable, if you will, in which case the lung physically pulls away from the chest wall, causing an imbalance of pressure which favors increased filtration of fluid into the pleural space and formation of a pathologic pleural effusion.
Issues applied in Ecuador. The main result of the study carried out by the Central University of Ecuador, where the high proportion of infection spilled and 22%, followed by thoracic cancer and 33%, and there were no difference in the proportion of exudates between patients with benign or malignant effusion.
Pleural effusion. It is accumulation of excess fluid between two layers of pleura, parietal pleura and visceral pleura, two layers. And it is a complication caused by a number of pathologies that includes heart failure and pneumonia. The thing to be noted here is that there is always some fluid between two layers of pleura to save lungs from injury by friction, as lungs are always moving. It is only when an excess amount of fluid gets accumulated in pleural cavity, it is regarded as abnormal. So how it would show up on a chest x-ray? This is a normal chest x-ray taken in a standing position, and if there was a pleural effusion, these are the areas that would show pleural effusion first. Right claustrophrenic angle and left claustrophrenic angle. Again, this is because fluid is heavier than the lung and it has to fall towards the gravity. So these are the areas to first show effusion. Notice a very nice and sharp right claustrophrenic angle on this x-ray, and very nice and clear left claustrophrenic angle as well. If you look at this x-ray, the left claustrophrenic angle is blunt here, it is not visible. It is not as clear as it should be. So this patient has got a small amount of left-sided pleural effusion. Also notice there is an area of consolidation here, which is probably causing pleural effusion as well. Now this patient has got bilateral pleural effusion on both sides, on right side and left side, and the effusion is big enough to create fluid level here and here as well. If you look at the lateral view of this patient, you can again see two fluid levels which are indicating bilateral pleural effusion.
Conclusion. In conclusion, there are numerous diseases that can be associated with pleural effusion. Diagnosis and treatment in pleural effusion are very important to avoid complications and even death of the person who suffers.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition. Page 561. What is pleural effusion? Pleural effusion is the excess fluid that accumulates between the two pleural layers. Pleural cavity is a fluid-filled space that surrounds the lung, so when you have excess fluid in this area instead of the normal amount of fluid, this is called pleural effusion. And this excessive amount of such fluid can impair breathing by limiting the expansion of the lungs during ventilation. Briefly, describe the difference between transudate versus exudate. We talked about the difference between transudate and exudate back in the pathology chapter, so we will highlight the facts again. Transudated fluid is the fluid that has less cell content, poor protein content, and the specific gravity is under 1.012, whereas exudated fluid is high in cellular content, rich in protein content, and the specific gravity is greater than 1.020. What are some causes that would lead to transudative pleural effusion? Transudative pleural effusion occurs in congestive heart failure, nephrotic syndrome, and hepatic cirrhosis. So in all these conditions, the transudative fluid is going through tight blood vessels. Name all the causes of exudative pleural effusion. Exudative pleural effusion occurs due to malignancy, pneumonia, collagen vascular disease, and trauma. In all these conditions, there is an increase in vascular permeability. So if you remember when we talked about exudate in the pathology chapter, we mentioned that exudative fluid and cells go through loose blood vessels.